From the News Channel 5 Network, this is OpenLine.
Hello, everyone. Welcome to Open Line on Thursday night. I'm Ben Hall. Great opportunity tonight. Free dental advice. Where else can you get that? You won't get that on Survivor or some other show. Only here can you get free dental advice. And we're very happy to have with us for Ask a Dentist tonight Dr. Christopher Sandlin. Doctor, thank you for being with us.
Pleasure to be with you.
You are at Bluegrass Endodontics in Hendersonville and Mount Juliet.
Correct.
And, all right, so it is Ask a Dentist, but you specialize in something that terrifies people. What is it you specialize in?
Root canals, root canal surgeries, anything to do with the inside of the tooth.
And, all right, so let's talk about root canals. How do you know you need one? Let's start with that, and then get into why people are so terrified of this procedure. But how do you know that, okay, I may need this?
Well, I'd say majority of the time your general dentist is going to be looking at radiographs, looking at cavities, general exams, and he'll point out the fact that I think it's time. But as a patient, if you start to experience pain like exaggerated responses to cold, hot liquids, spontaneous pains, lingering pains, those all may be an indication that a root canal is around the corner.
Around the corner. And why do you think people are so terrified by it?
Well, if you look at the history of endodontics and root canals, it does have a certain tortured history to it. But there have been some amazing advances in the past decades. And root canals really shouldn't be something that you should be worried about.
And now, why not? What do you mean by amazing advances?
With anesthetics, nitrous, sedation, there's really not a reason to avoid it.
So you won't feel the pain?
You shouldn't, and I tell patients if you feel the pain, then you're going to the wrong doctor. So it's my goal to overwhelm them with confidence and profound local anesthetic. And before we treat any tooth, we generally like to try and reproduce their chief complaint. So if they come into my office and they complain of cold sensitivities after we numb them up, I try and reproduce that cold or the lack thereof to prove to them that they are in fact numb.
Oh, I see. So you would put that on their tooth and they can't feel it, and that gives them confidence that whatever you're going to do. And is that a big issue for you when people come in? Do you see people that really are just really scared and
petrified?
So you see that
every day. Every day. And one of the gratifying aspects of what we do is the bar is sufficiently low, so by the time they leave our office having a pleasant experience, they can look back and say, that really wasn't anything to be worried about.
Why do you think dentists have that? Why has that become something that just does scare people on such just a gut level?
Well, it's fun to make fun of root canals.
Yeah.
And I've found the majority of people that are making fun of them generally haven't had one. So, and there are some bad root canals out there, which is where the endodontic specialist comes into play. We've got a better success rate at finding the canals, treating the canals to full length, filling them to an appropriate density, and doing it all in a comfortable and anxiety-free way.
Anxiety-free. We already have a couple calls. If you want to call, a few lines open, 737 plus 737 7587. That's the number. And let's talk just what it is. So a root canal, we've all heard the term, but what are you doing in one?
Well, it's funny because I have all kinds of misconceptions. Half the patients want to know, half don't want me to explain anything. They just want me to do it. But generally, the inside of the tooth, or the internal anatomy of the tooth, mimics the external anatomy of the tooth. So if you have a round root, you're going to have a round canal that runs the length of the root. And likewise, inside the tooth, if you've got cusps and peaks and valleys, inside the crown, you have likewise anatomy that kind of peaks. And so inside that hollow chamber in the tooth resides the nerve, the blood vessel, the connective tissue. And it's what we call a low compliant environment, meaning there's nowhere for it to really expand and swell when it's traumatized. So if it's insulted by decay or trauma or fractures, that tissue tries to swell and therefore it hurts. So when it gets to a point where that swelling is too uncomfortable or can't rebound, we have to take out that affected tissue before it becomes necrotic or dies and starts to abscess.
Okay. And you could have multiple root canals, right? Is that right or not?
Multiple root canals in the same tooth?
Or no, like if multiple teeth are hurt, would you just have one root canal, or would you have lots of root canals?
Well, generally I like to take a conservative approach. If there are multiple teeth in the area, try and tackle the problem that we know needs to be addressed first, because a lot of times you can have radiating pain to teeth in front and back, top to bottom. And so by taking care of the obvious problem first, a lot of times you can eliminate some of that radiating issue.
And there's nothing worse than tooth pain. All right, let's go to the phone. Sherry on line 1. Hello, Sherry.
Hi.
Hi. What's on your mind?
My teeth.
My teeth.
I have several cracked teeth on the bottom and don't have dental insurance. And unfortunately, disability does not cover dental, which is something I've often thought it should, because if I get an infection in my mouth, the way I've been told, it can go through your bloodstream and it can affect my life. Mm-hmm. Mm-hmm. I'm trying to find a dentist. I'm trying to find someone who would take payments. So that's about where I'm looking for right now. And I saw this. I just flipped the channel. And I'm like, yes, I need help. I'll get answers.
Well, good. Well, let's see. So what do you think there for Sherry?
Well, Sherry, there are lots of competent, quality dentists in the area. I'm not sure where you're coming from, what area. You may want to try asking some friends and family in the area to see if they have any good recommendations. As far as payment plans, talk to your office, talk to the general dentist and see what they offer. And there's always Care Credit, which is a financing program for health care needs, from optometry to dental to dentistry. So lots of options there. There are also reduced cost dental clinics like Interfaith in Nashville that work with your ability to pay and then work on a sliding scale. So there are a lot of options out there.
And what about her issue of cracked teeth?
Well, I'd have to take a look at that specific. Cracked teeth can range from small microfractures to split teeth, and the only way to really know would be to have an examination, take some radiographs and see. Obviously, if the fractures are too bad, then you're correct. They can become infected and would either need to be treated with root canal and a crown or extracted to prevent the infection. For small cracks, crowns are an option to prevent that crack from propagating any farther.
And so somebody needs to look at that.
Right.
Because, that sounds pretty serious. And she talked about how health is connected to your teeth, essentially.
Sure.
And I've heard it said that a dentist can tell how healthy someone is by just looking inside their mouth. I mean, how much do you see that? How intertwined are the two?
I'm not sure how much of a direct connection it is, and how much of it's just that's hard to say. Mm-hmm. I don't really have a good answer. Obviously, the better you feel, the more you smile, the better feel about yourself, the better you can eat, improve function.
Right. Yeah, I guess it is connected in so many ways. But all right, let's talk about some other things. So, root canals. I wondered, are you trying to save the tooth in that case?
Yes.
And explain, how does that happen? What do you mean by that?
Well, there's two parts of the living tooth. There's the internal tissue with the nerve and the blood vessels and all that we talked about earlier. And then there's also the living attachment to the socket, which is a ligament that allows the tooth to move ever so slightly and shift and erupt. And that's the primary difference between a natural tooth and an implant, which is fused into the bone.
Okay. All right, we have to take a break. We'll take a break, and then we will come back. If you have a question, there is the number, 737+, 737-7587. Take a break. Be back right after this.